Good day to everyone. My name is Dmytro Voskoboinyk. I want to tell you how to properly use the navigation kit from the company Alpha Dent. For this, we have a model of our patient who needs to have the sixth tooth extracted. Here, on this model, we are simulating the extraction of the sixth tooth. This is how it looks. Our patient has a kind of tooth stump and we remove it. Next, we need to use the navigation kit, which has already been prepared in advance. It has a sleeve. The sleeve is hexagonal. Why do we need a hexagonal sleeve? This is so that after this operation, we can make the patient an individual healing abutment like this, which must fit precisely into its correct position. That's why we need the hexagonal sleeve, and the implant driver in the kit will also help us to align the facets correctly. We'll talk about this a little later. By the way, this is a printed model, and inside there are cylinders inserted that imitate D3 bone. So today's drilling protocol will be for the Alpha Dent Superior Active implant, diameter 4 and 5 by 10 with D3 bone, because the drilling protocol changes slightly depending on the type of bone we're working with. So to start drilling, let's remove this cap and we take off this cap and we have the first drill bit that we need to use. In this case, it could be a tissue punch like this one, but we won't be using it because in our situation the tooth is already gone, right? We've removed it and we have access to the socket after extraction. If someone prefers to drill through the soft tissue, then this tissue punch is used for that purpose. But as a rule, we work with an incision. So the next thing after this is this kind of bone mill. This kit is not new. I've already been using, we have a lot of these kits and we've been using them for many years. But this particular kit has been in use for about a year and a half. So all the drills already have a bit of wear. But that's a normal process. Why do we need this drill? It's for performing pilot drilling. And in cases where the bone is narrow, it helps to avoid slipping out of the correct position. This is how it works. I'll show it on the lateral surface. And after using it, we have this kind of hole and a platform with a diameter of 5 millimeters, which allows us to stay in place and work precisely in this area. So, let's put on our guide template. The dispenser is set to 800 revolutions per minute. Some prefer 600, others 1000, but we've settled on 800 as well. Now we take our bone mill and drill a little into our patient. People often ask how deep the bone mill should be inserted, since it doesn't have any markings or stopper. Our answer, we insert it to a certain depth, for example, about like this. With time, you'll understand how to do this correctly. And the next rule that must be followed is to take this drill bit right after the previous one. So, what do we need to do? We need to insert this drill bit into the handpiece and show you which rule needs to be followed. Look, we insert it like this, show it like this. Look, we insert it, and half of the barrel of this drill bit should go into our sleeve. If half of the barrel of the drill bit goes into the sleeve, we can start drilling. If half of the barrel of the drill bit does not go in, and for example, it looks something like this, that's incorrect. Because the tip of the drill bit, imagine this, the tip of the drill bit enters the bone, the barrel hasn't yet gone into the sleeve, and the tip of the drill bit starts drilling in a different direction. Then when the barrel finally enters the sleeve, it begins to deform both the guide and break the sleeve. So the next rule is you should use this drill bit only exactly as much as needed for your task. Where is that drill bit? For the drill bit to go in up to half of its barrel, if half of the barrel is inside the sleeve, we can continue drilling. Drilled. If this rule is followed with the first drill bit, then it will automatically be followed with all subsequent drill bits. Because the difference between these drill bits in this case, 6.75 and 8 and 10 is no more than 2 millimeters. The maximum distance is between the 13 and 16 millimeter drill bits. By the way, each row includes the following sizes: 6.75, 8, 10, 11.5, 13 and 16 millimeters in length. In our case, we have an implant that is 10 millimeters long. An implant that is 10 millimeters long, but we have what's called an offset raised. The sleeve is raised by 3 millimeters, so in this case we will be working with a positive offset. This means that in the standard protocol, if the offset were 0, we would finish drilling with drill number 10, right? With the hole number 10, in this case our offset is +3. This means that to place a 4.5 by 10 implant, we need to drill with a drill that is 13 millimeters long. So, step by step, we proceed to our 13 millimeter drill. There we go. One step, we proceed 10 millimeters. We can't skip any drill. Each drill must do its job because the barrel. There we go. Next, 11.5. The dispenser is set to 800 revolutions. Half of the barrel is in the sleeve, and we continue drilling. And the last drill, length 13 millimeters. Why 13? I repeat, the implant is 10 millimeters, offset +3. 13. We've drilled and we're in place. Next, people often ask how to proceed correctly. Should you proceed with the next diameter 2.8 using this drill, or should you go like this again? How does the bone allow? In this case, it's better to show you the correct protocol. At least I personally work with the next drill. You see, it has engaged and it has something to drill into, so it's better to drill like this. If the accuracy of implant placement is important to us, then it's better to go at least with the second row, to go again with 6, 75, 8. If you see that the bone is soft and the next drill will break through, you can skip one drill size, right? There are. And the diameter is 2.8, the length is 13 millimeters, and we finish with the size 2.8, right? Let me remind you, our implant has a diameter of 4.5. The bone is D3, so 100% we go through with the 3.2 drill as well. Immediately with the 13. At this point in the mouth, we could already start doing some tests and begin placing the implant even after this drill. But it's also important to determine whether we need immediate loading or if our implant will have a cover screw. If our implant is intended for immediate loading and we are using a healing abutment or a temporary crown, then we finish drilling earlier. If the implant will be placed with a cover screw, then there is no point in achieving high torque. Let's do the drilling with a 3.6 at 13. And this will be, for example, the final drilling. It's important to understand that if we are working with 0 offset, then according to the protocol, a 10 millimeter implant is placed using a 10 millimeter drill, just like that. In our case, we are working according to the +3 protocol, and our last drill is number 13. It is very important to understand that the tip of the drill will have a different diameter because the drill is conical, not cylindrical. My apologies. It's conical, not cylindrical. That's why, in fact, right here, the tip, the diameter would be completely different from the one here. This is because we are working with a positive offset. Next, we need to take the implant driver. In this kit, we have implant drivers. A standard implant driver with 0 offset, a +2, +4, and +6 implant driver. The number of implant drivers may vary because I have a somewhat custom kit here. So your kit from your dealer might have a slightly different set of components. But the kit has specific slots where you can purchase and add exactly those implant drivers or instruments that you personally need. Once again, we have an offset implant driver +3. So we will use the +4 implant driver and not advance the implant to 1 marking. But before we insert our implant and attach it to the implant driver, we need to perform a test. We need to insert the implant driver and make sure that it does not press against the bone. There are situations when the implant driver presses against the bone, for example, like this, and it doesn't go any further, right? In this case, we need to use our bone mill again, go a little first specifically by the number of marks that the implant driver is short, and then insert the implant driver again to confirm that in this case it even goes deeper. We will set it at +3, and it's just 1 mark short. Next, we open our implant. Let me remind you, this is an Alpha Dent Superior 4.5 by 10. We open it, the implant is moist, right? We open our implant, we connect it to the implant driver, like this. Just a second. There's no extra light here, so I can't see very well. Alright, this screwdriver. I recommend you use a short screwdriver. It's much more convenient this way. We've attached the implant driver. Once again, let me remind you, implant driver +4. We will screw it in up to 1 mark, not all the way. This will be +3 millimeters from the standard offset. We carefully insert our dental implant into the surgical guide, which helps ensure precise placement, and begin screwing it in gently by hand to start the process. Once the implant is securely positioned in the bone, we will then take a special tool known as an adapter for the handpiece, which allows us to connect the implant to the surgical motor for the next step. We insert it into the handpiece, like this, and on the dispenser we select the program specifically for the implant. Personally, I use a program set to 50 newtons and a rotation speed of 40. We can try to place the implant together. We try and do it in our practice with the handpiece. And for the final turns, we use a torque wrench and special heads for it. Yes, and press stop.